Medicare, Medicaid, and Social Security impact nearly every American. But what happens if these programs are cut? And how do billionaires like Elon Musk and politicians like Donald Trump influence these policies? Let's break it all down. The history, purpose, and funding of each program, which Americans rely most on these benefits. How much these programs cost taxpayers. The political debate around cuts to entitlement programs. Medicare and Medicaid were signed into law on July 30, 1965 by President Lyndon B. Johnson under the Social Security Amendments of 1965. Medicare provides health insurance for seniors, 65 and older, and disabled individuals. Medicaid provides health coverage for low-income individuals and families. Medicare serves over 65 million Americans, mostly seniors and disabled individuals. Medicaid covers 82 million low-income individuals, including children, pregnant women, and the disabled. The states with the highest Medicaid use are California, New York, Texas, and Florida. In the year 2023, Medicare's current cost stands at $915 billion. Medicaid follows closely at $805 billion. These programs are funded by a mix of payroll taxes, general revenue, and contributions from both state and federal governments. Social Security was created in 1935 under President Franklin D. Roosevelt as part of the New Deal. Initially, it was designed to provide retirement benefits for workers. Over time, it expanded to include disability benefits and survivor benefits. It's important to note that Social Security is not an entitlement or welfare program. It's a worker-funded insurance program. More than 70 million Americans receive Social Security benefits. Among them, 50 million are retired seniors, 10 million are disabled individuals, and 9 million are survivor beneficiaries, including spouses and children of deceased workers. The states with the highest usage are Florida, Texas, California, Pennsylvania, and Ohio. The current cost in 2023 stands at $1.3 trillion per year. This is funded by payroll taxes, specifically the FICA tax, with 6.2% paid by workers and another 6.2% paid by employers. Self-employed individuals, well, they pay 12.4%. Cuts to Medicare and Medicaid would mean that seniors and low-income individuals could lose their health care coverage. Hospitals and nursing homes would face significant financial strain, and prescription drug costs would rise for seniors. Social Security cuts would lead to retirees facing economic hardship. Survivor and disability benefits would shrink, leaving millions vulnerable. And younger generations would have to work longer before reaching retirement. Without reforms, the Social Security Trust Fund will be depleted by 2034. Medicare faces insolvency by 2031. Elon Musk's influence. He has publicly criticized Social Security as unsustainable. He advocates for private retirement plans instead. Tesla, his company, benefits from tax breaks, meaning it contributes less to federal revenue. Donald Trump's role. As president, Trump promised to protect Social Security and Medicare, but his 2020 payroll tax deferral plan temporarily reduced Social Security funding. Current Republican debates propose cutting Social Security to reduce national debt. Medicare, Medicaid, and Social Security help millions of Americans live with dignity. Cutting these programs could have severe economic and social consequences. Future funding needs reform, but eliminating these programs isn't the solution. What do you think? Should Social Security and Medicare be reformed or protected at all costs? Comment below. Like and subscribe for more deep dives into politics, finance, and history.